Images from the small bowel, from the duodenum right down to the ileum. Diagnosis and treatment in previously inaccessible regions. Double balloon enteroscopy is conquering the entire intestinal tract. Being able to examine every section of the small bowel endoscopically is a long-held dream among gastroenterologists. Standard endoscopy in the upper and lower gastrointestinal tract is only able to visualize the terminal ileum and upper small bowel. Using push enteroscopy, it is possible to examine up to 90 centimeters of the duodenum and jejunum. With the introduction of capsule endoscopy, it became possible for the first time to obtain endoscopic image documentation of the entire gastrointestinal tract, and in particular from the black box of the small bowel. However, there are also certain disadvantages with the capsule endoscopy system. It is not possible to guide the capsule's movement, and interventional procedures are not possible either. Double balloon enteroscopy overcomes these limitations and thus literally closes the last gap in diagnostic and therapeutic endoscopy in the gastrointestinal tract, particularly in patients with small bowel diseases. A revolutionary technique in gastroenterology. The double balloon enteroscope has an outer diameter of 8.5 millimeters and a working length of 200 centimeters. A flexible overtube slides over the conventional endoscope. Latex balloons are attached to both the tip of the endoscope and the overtube. The one on the endoscope is newly placed before each examination. A pressure-controlled pump fills the balloons with air. Sensors measure the pressure continuously and prevent a maximum pressure level from being exceeded. The way in which the double balloon enteroscope is used is easy to learn. Firstly, the endoscope is introduced into the small bowel and locked into place by inflating the balloon. The overtube is then advanced over it, and the second balloon is filled with air in order to stabilize its position. The endoscope, with its balloon now deflated, can then be advanced further forwards. It is then locked into place again. The overtube can now be advanced as far as the end of the endoscope. After this, the whole system is withdrawn. This causes the small bowel to slide onto the overtube. The endoscope is now unlocked again and moved forwards. Step by step, the whole small bowel can be accessed in this way. The principle can be grasped by looking at a training model using animal intestines. Alternating locking and advancement of the endoscope and overtube make it possible to thread the small bowel onto the overtube. Double balloon enteroscopy can be carried out with both the oral and anal approaches. No special preparation is needed for the oral procedure. Sedation is the same as that in conventional gastroscopy. After the esophagus and stomach have been examined, the endoscope is positioned in the small bowel and the overtube is advanced over. When the locked enteroscope is withdrawn under radiographic guidance, the loops created during advancement are cleared. This makes the examination easier and later makes it easier to use auxiliary instruments. For anal double balloon enteroscopy, preparation is the same as for colonoscopy, with at least 4 liters of lavage. Sedation is also the same as in standard colonoscopy. After the large bowel has been passed, the ileum is intubated and the overtube then follows. The subsequent procedure is the same as in the oral technique. Complete examination of the small bowel is possible in principle using the anal and oral approaches, but in most cases this is not necessary. Most findings can be accessed via either one route or the other. Double balloon enteroscopy allows diagnosis and interventional procedures throughout the whole small bowel. Direct biopsy of unclear findings allows fast and precise diagnoses, for example in suspected inflammatory bowel disease. Bleeding from angiodysplasias can be reliably detected and directly coagulated in every segment of the small bowel. Injection under the lesion is also possible, as is polypectomy. Endoscopic removal of polyps is therefore possible throughout the entire gastrointestinal tract. In addition, double balloon enteroscopy makes it possible to carry out all of the diagnostic and therapeutic procedures that are also carried out in endoscopy of the upper and lower digestive tract. Ink marking is also possible, as is marking by electrocoagulation. Finally, double balloon enteroscopy also allows the removal of foreign bodies, as in the example of this dental prosthesis with a small bowel invagination stenosis.
Die Doppelballon-Enteroskopie stellt ein sicheres und
Double balloon enteroscopy is a safe and effective procedure for investigating small bowel diseases. Double balloon enteroscopy also allows targeted biopsy of lesions, so that it brings small bowel endoscopy up to the same level we've been accustomed to for many years in standard upper and lower endoscopy, which we must expect to have in the small bowel as well. In addition, there's the option of carrying out therapeutic interventions via the enteroscope, replacing elaborate surgical procedures and intraoperative endoscopy procedures, and allowing treatment to be carried out economically in the same session as diagnosis. Double balloon enteroscopy, a tremendous advance in gastroenterology. Previously inaccessible regions of the small bowel can now also be reached using gentle and effective endoscopic medicine.